Okay, so we are going to move on to supporting your cleft-affected child. This is Dr. Meredith Albert. She is a licensed clinical psychologist with the cleft craniofacial team located at Shriners Hospital for Children in Chicago. Dr. Albert's clinical training and experience includes treating patients in the areas of pediatric psychology, trauma, rehabilitation, neuropsychological assessment. I just got this script, guys. These are big words.
And you're doing excellent.
Thank you. And cleft craniofacial conditions. She also currently works on several multi-site studies that seek to better understand and improve the functioning of patients diagnosed with craniofacial conditions. Dr. Albert is a member of the American Cleft Palate Association, chair of the ACPA's Mental Health Psychosocial Special Interest Group, a peer reviewer for the Cleft Palate Craniofacial Journal, a member of the American Psychological Association, and chair of APA Division 54 Craniofacial Special Interest Group. You sound very busy.
Now I know why I'm so busy when you're reading off all of that.
A lot of titles.
Makes me feel better about life. Thank you so much. So I'm happy to be here with everyone today. It was really interesting going through and listening to the panel speak. One, some of them stole my thunder because they talked about some of the things I'm going to address really quickly. And two, a lot of the things that both the younger folks and the older folks found helpful on their journey through their treatment, everything else, are the things that I provide recommendations for families. So I was giving myself a little pat on the back that at least I know I'm going in the right direction when I was hearing from actual patients or people who have been on this journey before, that those are the things that they too find helpful. So I also found putting this all in a 20-minute presentation to be terribly challenging because I could probably speak for about 2 hours on every single bullet point. So I'm going to glaze through some things. I'll spend a little bit more time on other things as we're going through. Okay, so common psychosocial and academic concerns. This is not a conclusive list by any stretch of the imagination, but some of the things that we see that we highlight in our clinical practice. Learning disabilities. And so these are not things that, you just enter into school. These are things that your child is 2 years old or 3 years old, and we want to see how speech is developing, because speech is going to be a precursor to how children read and how comprehension works and a lot of other academic-based skills. So as most everyone knows here, this is not a, hey, you're 5 years old and we're starting our cleft care journey. This is, you come in at day 1 or prenatally even, and we start looking at all of these areas of development from the get-go to really keep an eye on everything. Attention concerns, that can come from a lot of other places besides your traditional ADHD type diagnoses. That is something we see a lot in clinical practice. And so that's something that we keep a really close eye on as well. But attention can also be influenced and affected by other areas of functioning. And so it's something that will affect a child across all areas of development, all areas between school and home and interpersonal interactions. And so that's something we keep a close eye on. There we go. Depression and anxiety. Again, when a lot of issues have come up with discussion in the last 2 panels about bullying, and that's another topic I could spend quite a few hours talking about. And so all these things overlap. None of these things that I'm talking about today happen in isolation, and I think that's really important to keep in mind. And bullying, as I just brought up here, is one of the other things that we keep a close eye on. And then I put impact of COVID. That's another topic in and of itself, and so I'm not going to spend much time talking about that today, but that's certainly been something that's directed care. It's been interrupted surgeries for children. It's affected school. It's affected interpersonal life, and it's just an unfortunate part of our reality at this point. And I think, again, as I mentioned earlier, it's really important to keep all of these things through a developmental lens. What looks like important for a 6-month-old is very different. What looks important for a 3-year-old, what looks different for a 6-year-old versus a 16-year-old and even a 20-year-old when they come into care. Let's see if this, identifying difficulties. So oftentimes parents will come in and say, I don't know if my child's having trouble, how can I figure that out? And I think there couldn't have been a better example than with some of the folks on the last panel saying with bullying, I never told my parents that I was being bullied. So we're not mind readers. Most parents, I think I can read my kids' minds, but I really know at the end of the day, I can't. I wish I could. It would make my life a lot easier. And so how do you look for those outward signs of what is going on with your child if they're not verbalizing it? So, help. My child doesn't like school. Some kids just generally don't like school, and that is okay. But when there's a child that has a history of speech and language difficulty or things like that, we want to keep, that's affecting their development, we want to keep a really close eye on how to come up with different, just to figure out what's going on. So oftentimes we'll have a child entering kindergarten, they're entering first grade, they might be under speech pathology services, and they look like they're doing okay. And then all of a sudden third grade hits, and that child doesn't want to go to school, and they're miserable, and then the question is, well, what's going on? Well, sometimes learning disabilities and things like that can be really subtle, and sometimes they can be really pronounced, and the subtle ones are the ones that are really hard to keep track of. So you do want to look at things like how are they doing in school, getting teacher reports, how are they doing their homework at home? We go back to the attention thing and things like that of how they're able to attend to their task. What are their feelings about school? And we'll talk in a minute about how to talk with your children about these things as well. Attention, this is my favorite. I have parents come in all the time. But my kids are playing video games just fine. They can watch a movie for 4 hours and not, divert their attention. But they can't sit and focus on homework, and the child's teacher is reporting they're, running around the classroom, they're being a disruption, all of those kinds of things. And so video games and television, they actually stimulate a different part of the brain and the different part of the attention system. They're also interesting for, your 4, 5, 6-year-olds up till your 25-year-old, 30, 40-year-old people sometimes, depending on who you are. And so that is important because your child can sit and do some activities, doesn't mean that their attention system is fine. Oftentimes, it also doesn't mean that your child has ADHD, and that's where I go back to how important it is. You can't look at these things in a vacuum. You have to look at these things across the board. It's like a big puzzle. And all these pieces fit together, and all of these different areas of functioning influence one another. When I have a parent come in and say, my child doesn't like to go to school, or they're not paying attention, or more importantly, the teacher is saying they're acting out in class, my first question is, well, one of my first 3 questions, besides are they sleeping and are they eating, the other most important question is, how are they doing in school? Well, I think they're doing okay. I don't know, their grades seem to, be fine. We're not getting much of a report home from teacher. This often happens like the first couple months of school too, before you start really getting evaluations of how your kids are doing. And so that's the part that I'll spend a lot of time talking with parents about is there any difficulty with learning and how kids are doing in school? Because oftentimes there is. And oftentimes when we get those intervention services in as early as possible, it really, really, truly makes a difference and will affect the trajectory of how kids do in school for the remainder of their time there. Mood. My child is crabby, irritable, and doesn't want to do anything. This is all thinking a lot of the teenagers. Teenagers are crabby and irritable, and they don't want to do things. That doesn't mean that they have depression. Sometimes they're just what we call teenagers. But it's really hard to tease out. I feel like the 10, 11-year-olds, that kind of emerging puberty age, are some of the trickiest kids because you don't want to over-pathologize your children. You don't want to say, like, oh, they must be depressed or something else is going on, or maybe they're just a crabby person. And so when we talk about in a minute how to help and support your kids, I think those are just important things to really keep aware of. Also, for younger kids, we think depression looks different, or feeling sad often looks different. For adults, the stereotype is you close your eyes, you go to bed, you pull the covers over your head, or you eat 3 pints of ice cream, or something different. And for kids, that's not what issues with mood often look like. It will come up as being irritable or crabby or disengaging from activities and things like that. And anxiety. My child avoids activities and is scared to try new things. And that can be a telltale sign of something's going on, that they're nervous about something, a new situation, a new environment. This, again, I feel like I just want to put a big circle around all of these things. So when we talk about bullying, if a child's feeling anxious about going to school, is it truly anxiety, what we call, or is it something else? Is there bullying? Are they nervous about how they're doing in school because there are some learning challenges? And so some of these will be the telltale signs of if your child doesn't want to go to school. Well, are they anxious about something? Is it the learning part? Is it the bullying part? And so that's where parents get to be detectives and really do some good investigation to help figure things out. And I already have touched on this a couple times, and this is a huge topic. I think it's really important to keep in mind that kids with craniofacial differences are one of the most bullied and targeted groups. So obesity and kids with migraines being some of the other groups. And someone said to me, well, how come kids with migraines are those that are affected? Because migraines you can't see, but people are missing school, and that's a whole nother discussion. But those are the three areas. And so most importantly, when you look different, that makes you a target for other kids. Social media is, I think I just heard on Jimmy Fallon or something like that, that it was the 25th anniversary, something of the iPhone, and basically thanks Steve Jobs for like changing the way we're raising our kids, and it's really true. So I'll talk again in a minute. I can't state enough how important it is to be aware of what your children are seeing on social media. When some of the older, younger folks that were up here earlier were talking about bullying and they never told their parents, two are young enough that they would have had social media. I think one might have been, where we were still writing paper notes back and forth to each other in school and things like that. But cyberbullying is a really big problem, and it's really important to be aware of what your kids are seeing on social media and what's being sent to them on social media, importantly as well. Okay, what can we do? A lot of times being a parent in any situation feels like you're in the deep end and you're drowning and you're helpless because every child is different, and what works for one child won't necessarily work for another child, and I think that's really important. So when you're working with younger kids, I always tell parents, don't just try something once. If you're talking about my child has sleep issues, well, we tried this bedtime once, it didn't work. Or we tried putting them to bed by themselves this way once, it didn't work. And so it's really, really important. You got to try things a couple times, and tracking, keeping track of what you try and what works and what doesn't work. And that's really, really, truly important to help you make decisions. And again, tweaking some things just a little bit, sometime you'll have great success with how to help your child. So talk with your child. I think that was a huge theme that came up from the last two panels. No one knows themselves better than kids themselves. I think that is just so important. Even little kids, we always think like, 4 or 5-year-old kids, what can they add to the conversation? Talk to them about how they're feeling. The 6 and 7 and 8-year-olds, parents, I know with my own kids, and they would probably, if they were up here, tell you that I do this all the time. Well, what did you do? How did you help? Blah, 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 blah. Like, that's not helpful. I get nowhere. Where with that. And so really asking open-ended questions, trying to keep that communication as open as possible is really important, and know that your kids are listening. It was brought up earlier too with hearing difficulties, and so one of the things we talk a lot about with parents is there's a difference between hearing and listening. Hearing are things that audiologists work on with you. Listening are things that, parents and psychologists and other groups of people will work on with you. Talking with your school. This is always a tricky one for me because I will have parents come in, and a lot of times they've tried to work with their schools and it gets really frustrating and they can't get connected with the right person, and there's a fine line between an aggressive, overbearing parent and being assertive. And this, I think, also goes with your medical care team as well, and I've given talks with my own teams about this different issue of you have to be assertive. Parents aren't being pushy. Parents aren't being, bullies themselves. You have to advocate for your kids, and the other professionals working with you have to understand that and there's a good way, to go about doing that, and there's a less good way to go about doing that. So being firm and clear in your expectations and being very concrete, I think, is also very helpful. You can also look for educational advocates in your school and things like that as well to help you. And most school districts do have some kind of educational advocate that can help. Don't be your child's therapist or teacher. My kids tell me that all the time. So I probably say do as I say, don't do as I do. But you're not I'm assuming most people in here are not trained therapists, and most people aren't teachers either. And so going out and seeking those resources and those services for your children is really, really important. Good self-care and good parenting coping skills. Every new parent that comes into our clinic, for our team visits, we will see children as young as a week old. And so our team treats 0 to 21, 22. COVID has extended that age a little bit just because some surgical plans got delayed. And so one of the questions, and I always give parents a couple lectures, and one of them is taking care of yourself. If you're not taking care of yourself, then you're not going to be any good for your child. And so I always joke, particularly for first-time parents and when they have a 6-week-old, if you run out of underwear, you can go to Target and buy more. It's not a big deal. If you eat pizza for the 3rd night in a row, it's not a big deal. But sleep if your child is sleeping, because you're exhausted too, and that's really important. I know a lot of families, particularly those who have children that are more challenging to feed at the beginning, get really hesitant to leave their child with a grandparent or an aunt and uncle or a child care provider because they're not sure that they'll be able to feed their child. So then time it. Little Sally sleeps from noon to 2. Plan to have somebody over there. I challenge any parent of any child to be able to go out with your spouse or significant other and have a conversation that's not about your child, but it's really important to try to be able to, right? To try to be able to do that, or even just going to take a walk, or just getting yourself to the gym, or even going to the grocery store by yourself can be a luxury. And really, that really is truly important. It's also important around times of surgery with your children, making sure that you do have grandparents around, particularly if you have older children or other children that need support as well. Educate yourself and set realistic goals. Again, this goes back to social media. I think Facebook groups, I think things that you find on social media are great. However, what one family's journey is not necessarily your journey, and so I think you do have to read and think about the things that you come in contact with a little grain of salt, because what happened for one child or one family might not necessarily be true for your family. Something came up earlier in one of the earlier talks that I thought was important too. What was the gentleman's name that was sitting on the end? Mark. So Mark said, well, he maybe his cleft wasn't as severe as some of the other panelists' clefts. And so we used to have, before COVID, all of our team days, all of our patients were in the waiting room together, and it was actually quite a cool thing because families would get connected with one another, and so they'd be sitting in the waiting room. We had families that would come from Florida and Texas, and they would then forevermore schedule their team visits at the same time because they would want to overlap for, they'd spend a couple days in Chicago together, or the kids became friends. But I would have other families that would come and say, wow, my child's issue or my child's diagnosis is not as bad as that child's diagnosis, and while that might provide some sense of relief, your journey and your difficulty with your child is your journey and your difficulty with your child. And I don't like to say, well, this one's worse, and something can always be worse, right? We know that in life. It can always be worse than the next place that you go. But to really not to minimize your own experiences, even if in the back of your head you can keep it in the context of, my child's diagnosis might not be as severe as somebody else's diagnosis. Assessment is really, really important, and this is another tricky piece through the schools to when you might suspect that your child has some kind of learning difference. Schools are very under-resourced. There's usually one school psychologist for like a whole school district, and that makes things really, really tricky. And if anyone has ever tried to go get an outside neuropsychological assessment, they cost like $4,000, and insurance doesn't generally pay for them. And so it really puts parents in a bind, but it is really, truly important to be able to figure that out. And so that's where you might have to get very, 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 very assertive with your children's school district or your insurance company to make sure that those services are met so that you can be best informed so that your child's getting the best care they need. School-based services, 504 versus an IEP, it's really important. One, you need that evaluation of some sort to help outline whatever services your child might be, and it might just be, they don't even need speech therapy, they might have hearing difficulties, and so their IEP or their 504 plan might be for a hearing service or for an FM system or something like that, or it might be more significant academic remediation. You always have to submit those things in writing, and that's really, really important. School districts will not look at it, and unfortunately most have 30 days to respond, and then you respond, and then you've got 60 days to respond, and it's a back and forth. And so it's a frustrating experience for just about every family that has to deal with it, but sticking on top of it so that your child does get the best resources, because all of those other things that I already mentioned, like having your child being frustrated with school and anxious about school, can really help support some of those things. And seeking out mental health services obviously are extremely important as well if you do think your child is struggling. Schools are a great place to go to with the school social worker or school counselor is a great place to start, but then seeking outside mental health resources as well. And lastly, other strategies to support you. I have two more here. So validate your thoughts and feelings. One of the worst things you can say to your child is, you're going to be okay. Because to an 8-year-old, if they're getting picked on or something's not going right, or a 12-year-old's not understanding their reading assessment, they don't feel like they're going to be okay. And so being more proactive of, okay, this sounds like this is really challenging or this is really upsetting for you. What can we do to work this out together? Avoiding the dismissive reactions, like I just mentioned, is really, really important. Teaching feeling vocabulary and modeling good behavior. So, and I know I have to do this with my own kids when we run across some roadblocks, as frustrated as I feel, I go somewhere else and like scream my head off about whatever it is, or my husband and I go take a walk and we just complain about everything. And then we come back and say, we're gonna work on this stuff together, guys, and we're gonna figure this all out. And that's always very tricky, but that's what kids need to hear, because they wanna feel safe, they wanna feel secure, and they wanna know like somebody's got their back to work through this. We're not just mad, sad, happy, like we have other feelings, like we're frustrated, we're irritated, we're annoyed. Getting a really good feelings vocabulary and doing that early on is really important. And then also with that piece, it came up with how do we talk about things, like if kids ask you. One of my favorite things to talk with families about, and this usually happens in the clinic when a child's about 4 years old, getting to be school age, and a parent says, what do I say if someone asks them about their scar? And so role playing is really important, and coming up with a script is really, really important. And so not starting off from the get-go, not calling, oh, this is your boo-boo, or this is your owie, like this is my cleft scar. This is my scar from when I had surgery, and from the get-go, and teaching older siblings that's the appropriate language, and having kids, if they're asked, what is that on your face? Well, that's my scar from surgery I had from when I was a baby. Where are your scars? Because as we've already said, every 5-year-old, I got one right here, it's lovely, from a family obstacle course, 4th of July weekend. And normally when I've shaved my legs at work, I'll pull my pants up, or if I'm in a skirt, and say, these are my scars. This is where I had surgery when I was a kid. And that just helps kids find some common ground with other kids, and it demystifies things, and it takes the power out of it. Because if a child's not confident, and this came up in the last panel, you want to instill confidence with your child from the get-go. And if they have appropriate language, if they're able to answer those questions, that's really, really important. And the designated family time, and I think I liked the wagon analogy, is that making sure your kids know that you have that time together. Be your child's advocate and where to find support. Schools, and we've talked a lot about that. Unfortunately, some schools are better resourced than other schools, but figuring out who the point person is to talk to is really, really important, and sometimes that requires a little detective work in itself. Pediatrician and primary care doctor are another really good resource to use, particularly if you're looking for some kind of evaluation, you're looking for an assessment, you're looking for other community-based resources. Your cleft team is obviously very helpful, and usually they're pretty well resourced on at least where to direct you. For most teams, you'll have some sort of mental health provider, obviously your surgeon, your team social worker, your team nurse practitioner, your team speech pathologist, audiologist, and everyone that makes up a part of your child's world. Because those folks, and I have a new round of graduate students right now that started, and I walk in with some of my families, and we don't even really talk about what's going on for the first 10 minutes. We're catching up because I've known some of these families for 8 years now, since their children came to me when they were 6 weeks old. And so it's really it's a special thing as a provider to be invited into families' lives, and we recognize that, and using those folks as resources. Local community health is really, really important. For better or worse, there's mental health, and mental health services are getting a lot more recognition. I don't know if we're getting more services to support the need, but we are getting a lot more recognition, and so making sure you seek out those services. Insurance companies, not maybe all of our favorite places to go looking for resources, but your insurance companies will generally be able to do some of that legwork and some of that research to find providers, at least to start with, that are in network. Psychologytoday.com, I always feel like this is a really silly thing to share with families, because people, at the end of the day, it's an advertising marketing tool, but I know a lot of independent practitioners who do promote their services, and so you go in, find a provider, you put, I'm looking for a provider who's in this zip code, that takes this insurance, that treats, children that are dealing with anxiety right now, and it's a good starting point for a lot of families to find services. And what's come up, in just the last week or two is the 988 emergency mental health. I'm not going to say it's great. I'm not going to say it's bad, because I don't know anybody that's used it yet. But it does show that our society, our culture, are just realizing that the struggles that everyone has are so significant right now, and the need for services. So, questions? It was not as exciting as some of the other talks. I'm sorry.
No, definitely was.
So I'm just going to, my daughter is adopted from China, so she was institutionalized for 2 years, cleft lip, cleft palate affected, and she has been diagnosed, she's on the autism spectrum. We had the hardest time getting her diagnosed because she was the ideal student. She didn't talk, I'm like, she's in 3rd grade, she's supposed to have a social life, And so I'm just wondering if you have, because you talked a lot about attention deficit, have you noticed, because she's with autism, she's very hyper-focused. Have you noticed that, any correlation in your...
I think attention issues can come from anywhere, right? It can come from an independent autism diagnosis. It can come from just attention issues. It can come from anxiety. One of the hardest things as a clinician to tease out is anxiety versus attention, because if you're worried about something, it's really hard to focus on your math sheet or taking a test or things like that. And so I think that, yes, you can be, it's all the part of executive functioning, and so that goes back to some of that assessment. When I have kids that I suspect might be somewhere along the autism spectrum, I will refer them out for assessment, because that's not my area of expertise. But I think one of the things that really hits me of what you brought up is she's the kid that was sitting quietly, right, in class, maybe doing okay in her schoolwork and not causing any issues. And so she's the perfect student, right?
And this was every time we would go in for an IEP or 504 meeting, they go, oh, she's the ideal student.
Right.
I'm like,
No, there's something that there's
something.
my parent radar is telling me there is something that's not going on here, and that's where you have to that fine line between being assertive and aggressive and saying no, there is something, and then going, if the school's not listening to you, going to your pediatrician, going and finding a place to get that evaluation.
And that's what we ended
done.
up having to do,
Yeah.
because we did go through the school, and the school was like, she's fine.
She's fine. I have a young man we just started doing an assessment with last week, and he could get evaluated through school, but Dad said, I'm much happier coming with you guys to do it because he just knows the thoroughness of what we're doing is going to be much better. And I know how overworked and how under-resourced schools are right now, and so I'm by no means ever wanting to criticize schools. I think we can criticize the rest of the community for under-resourcing our schools and not providing those services. But I think attention can come. Sometimes the hyper focus on things might come because I'm anxious not to look, at something else. It might be related more to the autism spectrum.
Right. And the other thing is she also has language processing disorder, which, again, is that from the cleft, and not being not being able to suck or being institutionalized and not speaking English for 2 years. There's so many things.
It's a chicken and an egg question. Yeah. And someone said, to me earlier, how did you get involved with working with a cleft team? Because I don't have a craniofacial difference. My children don't have craniofacial differences, but my background was in neuropsychology and pediatric medicine. And I applied for a position at Shriners that was actually with the spinal cord team because I had done a lot of work with spinal cord and TBI, and they said, we actually need someone for our craniofacial program. And I said, that's great, but I don't know anything about craniofacial care at all. But I was so well educated and so well trained, and my professional background had been with all of the things that go along with it, that I just read a lot of medical textbooks and spent a lot of time with our surgeons learning about the medical side of it, because the psychosocial, behavioral, cognitive side of it can run across all different populations and all different groups.
Thank you.
You're welcome.
Okay, we have time for one more question.
Thank you. Do you see in this population of kids PTSD? I'm a nurse practitioner in adult cognitive neurology, and so I think pediatrics is foreign to me, but I wonder, as my 2-year-old son, who's born with a cleft lip and palate, as I was, my husband and I were helping him through, that first year of NAM, kind of what I felt to be a torture, kind of those taping practices and everything that I knew was for his own good. I just, I kind of at some points felt like he doesn't understand. I didn't know if, with the surgeries and everything that these babies are going through, like if you saw anything long-term that was a result of that.
That's a great question. That's a very loaded question too. So I'm going to give you my short. No, it's a good question. So one of the conversations that we'll have for new families that come in for the first time with a child with a cleft, and one of the things that I tell them is, your child is not going to remember this. And I will tell parents too, guess what? You're not going to remember these early surgeries either. And I use myself as an example. My son had a surgery when he was 9 months old and again when he was 15 months old. Not a cleft-related surgery, and it was at the old Children's Memorial, the first one was. And the only thing I remember, I'm sure he was fussy, I'm sure I didn't sleep for a week afterwards, I'm sure all of those things that for those of you with younger children is still kind of clear in your mind. The only thing I remember is he's 13 now, there was a McDonald's in the basement of the old Children's Memorial, and not understanding why there's a McDonald's in 2010 in a children's hospital in the basement. And again, I'm sure all of those other things that came out. So that being said, I wouldn't say PTSD in its true form of diagnosing. I think the flip side of it is, I'm a big believer that we're influenced by our early experiences and that there is nonverbal memories that we can develop. But I think because children are so little, providing that support and providing what we call parents as protective factors none of those kind of none of that anxiety around it, none of that fear around it will sustain itself for the long term. And I think that's true now. We do have, I'll have a 6-year-old come in. I don't want to be at the doctor when I was 6 probably either. And someone brought up the example of someone walking in with all of these white coats on. That's scary. Sometimes the surgeon walks in with like 4 residents and I'm like, no, like don't go all in this little tiny room at one time. And so I think parents, caregivers, friends can serve as those protective factors. And so when the child feels safe in all other areas of their life, they get through those kind of what I would call traumatic experiences. And for you guys right now, the trauma is as an adult. And so you're thinking about it as an adult, which is very different than thinking about it as a child.
Thank you.